There are four numbers on every blood test result you have ever received. Not one, not two, four specific numbers sitting in four different rows that medical researchers have now confirmed across a study of more than 40,000 patients tracked over 12 years predict with startling accuracy who will develop a serious chronic illness within the next decade. Your doctor sees these numbers every time you visit. They are not hidden. They are right there on the printout. But almost nobody explains what they mean together. They are assessed individually. This one is fine, that one is slightly elevated, this one we will watch, and then you go home. What the research shows is that the combination matters more than any single number in isolation. And the combination that matters most is one that the majority of adults over the age of 35 are walking around with right now, without knowing it. Stay with me, because by the end of this video, you will know exactly which four numbers to look at, what the dangerous combination looks like, and what the research says you can do about it in the next 90 days. The first number is your fasting glucose. You have seen this on every blood test. It measures the amount of sugar in your blood after you have not eaten for at least 8 hours. The standard range that most labs flag as normal is anywhere below 100 milligrams per deciliter. Here's what your doctor may not emphasize strongly enough. The research does not treat anything below 100 as equally fine. A fasting glucose of 95 is measurably different from a fasting glucose of 82. The 12-year study tracked patients whose fasting glucose sat in the range of 90 to 99, technically normal by standard lab definitions, and found that this group developed metabolic disease at nearly 3 times the rate of the group sitting below 85. Technically normal is not the same as metabolically healthy. That distinction matters enormously. The second number is your triglycerides. This is the fat circulating in your bloodstream at the time of your blood draw. Standard labs flag anything below 150 as acceptable. Again, the research draws a sharper line. Triglycerides above 100, not 150, 100, combined with a fasting glucose above 85, begin to produce a compounding effect inside the body that standard individual assessments miss entirely. The cardiovascular system starts making adaptations. Inflammation markers shift. None of it is visible yet, no symptoms, no diagnosis. The body is simply beginning to move in a direction that, 12 years later, becomes a crisis. The third number is your HDL cholesterol. This is the one your doctor calls the good cholesterol. Higher is better. The standard threshold for concern is anything below 40 for men and 50 for women. What the 12-year study found is that HDL below 55 for both men and women, in combination with the first two numbers, begins to form what researchers now call the silent triad. 3 markers, each technically within acceptable range, each unremarkable on its own, that together predict serious illness with an accuracy that surprised even the researchers running the study. The fourth number is your HSCRP, high sensitivity C-reactive protein. This is the inflammation marker. Not every standard blood panel includes it. If yours does not, you can ask your doctor to add it. It costs almost nothing to run. An HSCRP above 1, not 2, not 3, 1, in the presence of the silent triad described above is what the research identifies as the complete pattern. 4 numbers, all technically acceptable by standard lab ranges, all present at the same time. And in the 40,000 patient study, this combination predicted the onset of a serious chronic condition within 10 years with an accuracy rate of 71%. 71%. That is not a marginal correlation. That is a predictive signal strong enough that several European health systems have already updated their screening guidelines to account for it. Now I want to be precise about something important. I am not a doctor. This video is not medical advice. What I am doing is explaining published research in plain language. Because the published research exists, it is not controversial inside the medical community, and yet most people have never heard this explained in a way they can actually use. If you go to your doctor tomorrow and ask them whether your fasting glucose, triglycerides, HDL, and HSCRP form the silent triad pattern, they will know exactly what you are talking about. This is not alternative medicine. This is mainstream clinical research. What can you actually do if your numbers form this pattern? The research is consistent on 3 interventions that show measurable impact on all 4 markers within 90 days. The first is the timing of your largest meal, not the content, the timing. Moving your largest caloric intake to earlier in the day, specifically before 2 in the afternoon, produces statistically significant reductions in fasting glucose and triglycerides independent of what you are eating. The mechanism is circadian. Your metabolic rate is highest in the morning and drops progressively through the day. Eating your largest meal when your metabolism is highest processes the same food differently than eating it in the evening. The second is walking, not running, not the gym. Walking, specifically a 10 to 15-minute walk taken within 30 minutes of finishing any meal. The research on post-meal walking is now robust enough that it has been adopted into clinical guidance in the UK, Japan, and several Scandinavian countries. A 10-minute walk after dinner reduces the post-meal glucose spike by approximately 30%. Sustained over weeks, this directly impacts your fasting glucose reading. The third is sleep duration in a specific window, not just hours, the window. The research shows the greatest metabolic benefit comes from sleep that begins before midnight and extends to between 7 and 8.5 hours total. Sleep that begins after midnight and covers the same total hours does not produce the same metabolic outcome. The body's cortisol regulation, which directly influences fasting glucose and inflammation, is calibrated to a pre-midnight sleep onset in a way that later schedules disrupt measurably. None of these interventions require a prescription. None of them require a gym membership or a special diet or a supplement that someone is trying to sell you. They require knowing that the pattern exists and knowing what the research says about how to interrupt it. Here is what I want you to do right now. Find your most recent blood test result. Look for those 4 numbers: fasting glucose, triglycerides, HDL, and HSCRP. If HSCRP is not on your panel, call your doctor's office this week and ask to have it added to your next draw. If all 4 numbers are present, write them down. Check whether your glucose is above 85, whether your triglycerides are above 100, whether your HDL is below 55, whether your HSCRP is above 1. If 3 or more of those conditions are true, you have the pattern the research identified, and you have 90 days to begin changing the trajectory before it compounds further. That is not a reason to panic. It is a reason to move. If this video gave you something your last checkup did not, then subscribe, because this channel exists for one reason: to explain the things that matter most in plain language. Whether that is a war that is about to hit your energy bills, or a blood test result that has been sitting in a drawer for 6 months, telling you something you did not know to read. I will see you in the next one.